Welcome once again to our live stream, food allergies, food sensitivities, food intolerances. I kind of wrote it on the margin here, food allergies, intolerance. There's a difference, food sensitivities, hypersensitivities. I could go off in multiple different directions, but today I want to keep this simple. I basically want to make it more application-based for you. And so that it's key to understand that how food sensitivities, food allergies, food intolerance, we'll get to kind of the root of those, but that they could be affecting your health. So what I did was I listed numerous manifestations in our body that are not always singly rooted in food allergies and food sensitivities, but can be significantly linked. So before we go to that, I want to thank you for being on board. Make sure that you know that we have multiple live streams, everything from GERD, heartburn, female hormone issues, premenstrual syndrome, menopause, men's health, prostate health. We've got dozens and dozens of live streams. You just got to scroll down through our archives. Make sure that you take a look and make sure that you tell some of your family members that they can go on and view these right here where you are, right at the website at AskJoeD.com. If you have suggestions for future teachings, we're all about that. Send us an email. You can send us an email at support@AskJoeD.com, AskJoeDiMatteo.com, and let's see what we can do, as long as it's reasonable. Back to our teaching for the day. Food allergies, food sensitivities. Why are we not tolerant? That's the real key. See, we're built and meant to be tolerant. It's very sophisticated. I believe in a creator. I believe in God. I believe that our body was created very specifically, intricately, because when you begin to understand that there's a Th4, there's a Th2, Th1, there are T lymphocytes, there are phagocytes in the lining of the intestinal tract, there is a GALT system, a gut-associated lymphoid tissue that literally that is like a trapping arena or catches things that are bad, viruses, bacteria, chemicals, etc. But these are all designed, if you will, to make you and to protect you and make you tolerant. How do we lose tolerance? That's the real key thing. Why does an individual become intolerant to multiple foods? Why do they begin to have sensitivities? Why do they begin to manifest a set of symptoms? And you go to your medical doctor and they're not real sure. And so they're giving you something for your migraines to abort your migraines. And then they're giving you something for your skin condition, your eczema, and they're using topical steroids and topical steroidal, maybe some non-steroidal type compounds. Maybe you've got significant joint inflammation and they have you on certainly non-steroidal anti-inflammatories. You could have a lot of wheeze and rhinitis and runny nose. You could have asthma attacks. You could have increased flushing after eating certain foods that you're allergic or you're intolerant to. I mean, the list goes on. Look at this. Musculoskeletal. You could have, a lot of skeletal muscle discomfort. I've got muscle aching. I've got joint aching. The skeletal system, the musculoskeletal system. Many of you that have food allergies and food sensitivities are experiencing chronic fatigue and fibromyalgia. So there are tons of manifestation. Indigestion, bloat, gas, genitourinary symptoms with problems with bladder and bladder functioning, even the probability of even things like interstitial cystitis, even though interstitial cystitis is a change in the lining of the bladder wall that we're not real sure what's at the root of that. But if you begin to develop some food intolerances, it's aggravating. So what we want to define today is, what's an intolerance mean? What does a true allergy mean? How does it affect me? Why has it affected me? And can I define them? Can I manage to get rid of them? Is there a way? Now, I want you to remember this key word, that our bodies are made to be, and I always have this happen whenever you leave these markers uncapped. Our bodies are made to be tolerant to foods. So this is the real problem, because many think that, I'm 29 years old and I'm starting to have all these symptoms. Every time I eat, I go out to eat or whatever, I got to run to the bathroom, or I have a lot of bloating or gas or IBS-like symptoms. And we think that that couldn't be us, because how's come I didn't have that all along? How come I didn't have that when I was 5 years old? Over the course of time, you could have become intolerant. So we're going to get to that. We're going to cover that. But I wanted you to see that this is only a smattering. I mean, I wouldn't, there's not enough boardroom for me to write the list of manifestations in the physical body that are related to food sensitivities. Everything from your musculature to your heart to your sinuses to your lungs, to wheeze and asthma, to runny noses, to skin, eczema, dermatitis, the list. Irritable bowel syndrome, colitis, inflammatory bowel diseases are often linked to food allergies, food sensitivities. So we've got to see that so much of this is rooted in our body's hyperreaction to these foods. But how did we get there? That'll be the key player. The other areas I think that I want to zero in on is that there are often psychological reactions as well. There is a psychological component. We know that even, for example, that even in schizophrenia, that there's a higher disposition of gluten and wheat sensitivities. We also know that in children with autism disorders and spectrum disorders and attention deficit and hyperactivity disorders, that there's a higher disposition of intolerances, maybe not allergies, but intolerances to certain foods, because we're not breaking them down well. These metabolites or these food components stay undigested in the circulatory system. They begin to elicit psychiatric type reactions. They're known as gliadomorphins, casomorphins, casein from dairy, gliadin from wheat. Gliadomorphine, casomorphins actually affect cognition, thought process, cohesiveness of thought. So you have to see that there are literally then like generic components that are psychologic, that can affect the thought process and cognition, that there is a toxic type reaction in the body from food intolerance that just makes you feel sickly. Okay, this gets, I mean, I'm going to do this in one setting today, and that's nearly impossible, but this gets deep, and I often say every time I do ones, I don't want to get too deep. I already feel like I get too deep. But you got to understand that there's significant manifestations. There's psychologic manifestations. There are toxic manifestations. There's an immune-mediated. I can have a reaction to foods, and it damages my immune system, or it negatively affects my immune system, and can be at the root of autoimmune types of situations. That doesn't mean that food allergy or that food sensitivity gave you the autoimmune condition. What it means is that it predisposes you. You might be genetically predisposed to that autoimmune disorder. Your vitamin D status could have been very low. You could have been under high levels of duress and stress, which are damaging the immune system. Or you could have been experiencing poor sleep habits. And then we open up the door to the development of food allergies and food intolerances that are damaging the immune system. Now I have the possibility for an immune-mediated reaction. The immune system is antagonized. It can begin to trip the switch. And then what happens, we have what's called, in many cases, Th1, Th2 imbalances. Now note that I said earlier that the body is very sophisticated. I believe in a God and a creator. This is the intricacies of just your digestive system are so complex. It's hard to even comprehend that anybody could imagine that our bodies just kind of came together. when you realize and when you see the intricacies of what's going on in our bodies, you will begin to understand that this system, this TH1, it's like a teeter-totter. It's like a seesaw. It's kind of like this. This is what's going on in our system. We need to have, this means I'm not overreacting to foods, but yet I'm reacting enough to be protective. I'm not overreacting. That's that TH1, TH2 balancing. When that TH1 and TH2 becomes skewed, and especially when I believe it's the TH1s predominate, what happens is now I can spiral off and trigger off into an autoimmune condition, an autoimmune type attack. All right? So that's a huge, huge area that we've got to see. Lastly, hypersensitivity. Some things are just, I react to the food, I have a little bit of a skin reaction, I might get a hive, it makes me feel kind of weird, strange, funky, I don't feel good. It's just a hypersensitivity reaction. It's not the end of the world. You eliminate that particular food and away you go. I'm more concerned about the ones that we don't see as a trigger. They could be delayed. Triggering headaches, triggering migraines, triggering colitis. See, when you define these, now you can start to get at the root, and it all comes down to this tolerance issue, okay? It all comes down to this tolerance issue. If I am more tolerant to foods, okay, I will not have as much of a reaction. If I don't have this system imbalanced, I won't have as significant a reaction taking place in my body. So let's clean this board up real quick, and let's talk about how this begins.
I spent all the time writing that up there. Now you're just going to...
I'm going to take it all off. If you haven't seen it by now, I need another board.
Then rewind.
Rewind. Yeah, I mean, I left them up there, and believe me, there are more that I just couldn't even list. But if we look at this, and we're kind of zeroing in on the root of this. Now, I've done some teachings, and we have that on the live streams with like a situation. We definitely need some new markers.
Slacking off. Get your Schweinberg out there. Get some markers.
We need some markers. Leaky gut. Now, this is one that we've talked about multiple times. We've done some teachings. Leaky gut is a significant issue. It's a problem. And this leaky gut scenario just means this. Let me draw this up for you. That if this is your stomach wall and you have ingested food, here's your diet, I have food particles being broken down, and then these food particles are supposed to get into, into your circulatory system, right? So these food particles, that's what's supposed to happen. But the first stop is the liver, so it's got to go to the liver. But what happens when I have not properly digested these foodstuffs with my pancreatic enzymes, with hydrochloric acid, betaine hydrochloride or hydrochloric acid, pepsin? When I have not adequately digested these food particles and they can make their way into my circulatory system in large particulate matter, this is where this GALT system, gut-associated lymphoid tissue, lymphoid is another word for lymphocytes, if I could spell, lymphocytes, which white blood cells. So now you can get a little bit of a picture as to what could possibly be happening. This GALT system, as I do not properly digest foods because I'm either under tremendous levels of duress and stress, and this barrier is weakened. Now that's a marker.
All right, Schweinberg.
Now that is a marker. Look at that.
Baby.
Look at that nice line there. All right. When this barrier is broken down because of high stress, okay, that's number one. Poor diet. And what would I mean by poor diet? A lot of white processed refined foods, not enough food sources of fiber, poor digestive enzymes. I don't eat live foods. Everything I eat is like a sandwich, a hamburger, it's all processed dead foods. You need raw nuts. You need some raw foods. You need to eat a mixed green salad. You need to eat some steamed vegetables. You need to eat an apple. You need to eat raw foods that have raw live enzymes in them. Poor diet, high stress, low fiber. I mean, all these things begin to contribute to a compromise to the gut wall. And high stress, what does that do? That causes a high secretion of cortisol, a drop in your DHEA levels, and it weakens something called secretory IgA, mucus barrier of protection. When that is broken down, now what's going to potentially happen is this gets through, these food particles get into the circulatory system, these lymphocytes from your gut system, it's meant by God to be back here to protect you, they begin to attack. They'll attack these food particles. When this happens, now we have the potential for delayed food sensitivity testing or delayed food allergies. Okay? The problem with that is that's where the immune system comes in. That's when I can start to have not just like what we always see, the immediate reactors. Like you go to your allergist, they do a skin prick or a patch testing, and they say, oh, you reacted to strawberries. You reacted to dairy. Okay, those are immediate reactors. Those are what we would term IgE. And they're real and they exist. But I don't know those begin to produce major symptoms in the body outside of maybe sinus, allergies, itching, skin conditions, eczemas. What we're zeroing in on today is more the delayed that is mediated by this gut-associated lymphoid tissue, lymphocytes, which are part of the armament of white blood cells. When I have to keep mounting an attack, here's what's going to happen. I'm exposed to this food. It could be a good food. It doesn't have to be a bad food. It could be something that's good for you. The more I'm exposed to it, the more I eat of it, the more heightened my reaction becomes over the course of time. So the reaction becomes more tangible each time. It's more violent, if you will, over the course of time, to the point where when the majority of our lymphocytes are reacting, I can now begin to develop these delayed food sensitivities, and now I can begin to develop reactions. Immediates, delayed. And that's about all I really want to get into. I mean, there's type 1 through 4 of this immediate category. There are so many different levels of this. And I don't want to get too caught up in making this complicated. The theme is not all foods are tolerable by all individuals. If I am intolerant and I begin to go beyond the immediate reactions, which are just simple, I hate to say it, simple reactions. Hey, they can be dangerous. I mean, you could have bronchospasm and wheeze and bronchoconstriction. So I don't want to say they could be totally simple, but I'm talking about like they're more overt. I eat this food, boom, I have a reaction. The delayeds are extremely dangerous because they go unseen, they're unnoticed, and they're back to that original list that I had up. They're beginning to mediate headaches, migraines, inflammatory bowel issues. It's not the sole cause. Your genetic issues, your gene dispositions, your nutrient status, and then you throw this in. Now I open the door to anything from genitourinary to skeletal muscle, to the skeletal system, to inflammation, to migraine and headache. KD bar the door. It's wide open at this point in time. So there is a difference, but understand that at the root of most of these, this whole leaky gut concept plays a huge role. So we're going to go to a break here. Not sure where we are time-wise. We're going to slip to a break. And when we come back, we're going to get into a little bit more of now how do you deal with these? First of all, we've defined that food allergies, if you will, they are real. There can be some that are mild, that they don't create a major effect on your body. Like, you know they're there. You can take an antihistamine, Benadryl, cetirizine, and go to your physician and give you a Medrol dose pack. You know, they're not life-threatening. They're immediate. Boom! They create a reaction. You can stop that reaction with medications, and that's about the end of it. The ones that concern me are the more severe, and they're in the delayed category, that then can start to open up a host of symptoms that we talked about on that front page. Either way, any way you look at this, there are probably at a minimum 20% of Americans right now running around that are developing or that have significant food sensitivity / allergy, etc., and we don't even know it. And we're being treated with XYZ medication for XYZ point of disorder or dysfunction in my body. The reality of it is, if I begin to define what the food patterns are, I can begin to lower what's called an immunologic load. An immunologic load. Now this is a little tougher. But each time, remember I said you eat a food, you consume the food, and you have a reaction. I consume it again, I have a more intense reaction. I consume it again, I have an even more intense. When this immunologic load begins to rise, and I throw in that I've got some leaky gut because of stress and life and work and eating on the run, low fiber, low residue diet, high amounts of sugar, all of this begins to kind of damage the gut, opens up the possibility for leaky gut. Now I damage the gut-associated lymphoid tissue. I cause my immune system, this is what this is all about, your immune system to overreact. And then I can begin to get distant site manifestations that could be delayed. They could be 12 hours later. They could be 14 hours. They can be 24. They can be up to 2 days, even sometimes longer. These reactions are delayed because the immune system is being antagonized. And each time it's being antagonized, it's mounting. See, the immune system has a recall mechanism. These lymphocytes have the ability to recall the reactions. And the more I'm exposed, the more I react. So part of the way we're going to get to this is healing up the gut. We've got a teaching just on leaky gut, how to do that. I'll touch on that because that's part of this. And secondarily, what can you do? Can you go through an elimination diet? Can you do a modified elimination diet? Can you do some testing? Why would I want to begin to define what's going on? If you're battling some level of symptoms, headache, sore throat, mucus production, asthma-like symptoms, digestive, joint bone, the list goes on. I'm only touching on a smattering of those. If I'm experiencing something that medicine has not been able to get to the root of, you've got to be able to consider this area. We're going to go to a break. Stay tuned. We'll be back with you in just a couple of minutes. Stay there. Thanks for staying with us through that little break. As we always like to try to do is to not just give you some inspiration. I don't ever want this to be a pep talk. I don't ever want it to be some mind over matter. I believe that it's not mind over matter. I believe that as we submit and surrender ourselves to our Heavenly Father, to our Creator, that good things begin to happen in our lives. And I'm going to read you a couple scriptures out of a little booklet called Divine Moments. And it's interesting because on the morning broadcast before we did this morning, talking about being thankful, and I read through Psalm 100 and talking about how Yahweh, I am. He's the beginning, He's the end, the I am God. It talks there about how we're to be thankful and to be praising Him. And that it says that all creation needs to praise Him. It's an imperative. It's not an option. The real key, the real test for us at times is when we're under duress, when we're being tested, when we're being tried, when we're under difficulties. Can we yet still praise Him and be thankful in the midst of those circumstances? That's the true test. And you see it in the lives of people like Joseph, David, Joshua, Moses, Ruth. I mean, you see literally an attitude, a disposition of thankfulness, of gratitude, and with eyes lifted towards Him, even in the midst of horrendous circumstances. So this little booklet pulls under a subheading of thankfulness, as I read Psalm 100 this morning, three nice little, I believe, scriptures that back up what we discussed earlier. Joseph replied in Genesis 50, 19, and 20, "Don't be afraid of me." He's talking to his brothers after his brothers discover that he's their brother that they tried to kill and they sold into slavery. And all these years have gone by. They thought he was dead. He's alive. They're thinking that we're getting beheaded right now. And here's what he says: "Don't be afraid of me. Am I God that I can punish you?" In other words, your punishment will come not from me, but you intended to harm me, but God intended it all for good. See, that even in the midst of that horrible circumstance, God had a plan for Joseph's life because He knew Joseph's life, and Joseph was going to be used to make provision for the nation of Israel, to keep them alive. "Be strong," says 2 Chronicles 32, "and courageous. Don't be afraid or discouraged because of the king of Assyria or of his mighty army. For there is a power far greater on our side." There's a power far greater on your side and on my side. "Be thankful in all circumstances." 1 Thessalonians 5. "For this is God's will for those of you that belong to Christ Jesus." So three key areas. Joseph says, "Don't be afraid of me. I'm not God. I can't punish you. What was meant for evil, the bad circumstances that unfolded in my life, were actually part of God's plan, and ultimately God will be the vindicator of me." Secondly, we see here, "Be strong and be courageous. Don't be afraid, but there's a power far greater on your side. God is ultimately at work, and be thankful in all these circumstances." So no matter what your situation, whether it's something that you've done wrong or maybe attack that you've come under, it could be more circumstantial. The end result of that is God can still be glorified. As we stick close to Him and praise and worship Him, God will be at work in our circumstances. And ultimately, as Joseph said, it was allowed, it was intended. God had an ultimate goal and end in mind. So I hope that encourages you today to even be thankful and prayerful, even when it's not conducive, easy, or comfortable to be so. Hey, let's move on to our teaching. And so we went through the whole scenario of food allergies, food sensitivities, more of an intolerance, what a hypersensitivity, and then what a true allergy is, one that just I get a reaction, no big deal, doesn't stay with me if I keep away that food, or I can take an antihistamine to block the reaction, or then the next layer is areas where they're delayed, where they're damaging the immune system, and now they can start to trigger changes in my body. Everything from a headache to a rapid heart rate to a runny nose to asthma to joint pain to muscle pain to bowel problems to bladder problems. The list is unending, okay? So now we talked about leaky gut. So now let's just talk about the next layer is, how do I deal with this? I mean, how would I do it? So you can do a rotation diet, which would just say, I don't eat the same food for like a 4-day span. So in other words, I would eat whatever. I'm going to eat chicken, I'm going to eat salads with olive oil in it, and I'm going to eat apples, and I'm going to eat pears. I mean, I'm picking some low allergen foods, and I'm going to do this for 4 days. I'm going to see, that's it, that's all I'm eating. That's a rotation diet. And then the next 4 days, then I will eat whatever. I'm going to have fish. I'm going to have quinoa. I'm going to have other fruits. So you begin to change. So you rotate. The next one, it might eat eggs. So now this is a little cumbersome, rotation diets. They're pretty tough. You got to write it down. The next layer would be, and we have examples of this for you to follow, etc. The next would be just an elimination diet, or what we would call the modified elimination, which, for example, I believe I pulled here. Our elimination diet would basically consist of things that you could eat: chicken, turkey, lamb, legumes, beans, legumes, lentils, cold water fish, white potatoes, sweet potatoes, rice, tapioca, buckwheat, millet, quinoa, amaranth, all vegetables. That's an elimination, modified elimination. A true aggressive elimination diet would mean, okay, so this is modified, and then a true elimination diet, is very tough. It's literally things like lamb, pears, maybe apples, and that's all you eat for 3 or 4 days, literally, because these are very low allergen foods, and then you begin to introduce back foods, but you have to keep track of this, so that's pretty tough. So you've got a modified, which is what a lot of times what we do, which gets you very clean, gets you away from dairy, gets you away from wheat, gets you away from colors, dyes, preservatives, artificial sweeteners, sodas. It's a very clean diet. You're eating a lot of basic core foods with minimal amounts of chemicals in them. That's the modified elimination. Or you can go strict elimination, which is this, and then begin to add foods back in. Every 1 to 2 days, you begin to add back in some foods. And then what you have to do is you kind of have to keep a little diary to document, well, I feel like after 3 or 4 days of being on this elimination diet, my joints aren't as achy. Then you add back in one food at a time, and you see. We like starting with the modified elimination because it gets you pretty clean. And then the reality is, then why not think about some testing? Some blood testing, some food sensitivity testing. And there's different options. So let's go there. So we're okay with this. So this would be kind of a non-costly way. Now, why would I do this? So first of all, let me just list them again so we have it. So we can have a pure elimination diet, which is tough. We can have the modified elimination, which is a tone down, right? Or I could do the rotation diet, and then I have to keep a track of things. Here I start adding them in one at a time. This one I just go straight. I eat a core base of foods, and I see how I feel. Many times we get a lot of response right here. Rotation is a little bit tougher. Strict elimination is very restrictive, problematic. But you have to see that this is a way for you to begin to enter. If you're experiencing a lot of those symptoms that we're talking about, this is an entry point. Now, the secondary way to do it is to do it through some type of blood testing. So you can do RAST, you can do IgE testing, you can do ELISA ACT. ELISA ACT testing, which is delayed food sensitivity panels. So, and there are other types. There are a lot of other types. But at some point, there's a lot of consternation here because they say, well, some of these are not reproducible all the time. I feel that if white blood cells and lymphocytes are reacting to food significantly, those need to be eliminated because now we're back to that whole immune process that could be damaging you and creating a lot of problems for you. Now, if you go back, we talked about before the psychological reactions. There are so many things. So this is not always just about the physical. That we even see that food sensitivities and food allergies many times are even associated with even depressive states and disorders and even anxiety disorders. So, to simplify this and to say, well, I'm having a food reaction, or let's just put it this way. My brother or my sister's having food reactions, and this is what they experience, doesn't mean that's what you're going to experience. Your food sensitivities could give you Y and Z, and your sister has X type reactions. So everybody, not everybody, but most folks will be different depending upon their own genetic chemistry and makeup. You could be reacting to the same food but have a different manifestation. And then you could have a different physiologic manifestation. Some it could be cognition, your thought process. Others it could be joint. Others it could be muscle. Others it could be your lungs and asthma-like reactions. So you could have the same food causing different reactions in the body and then manifesting at different sites. What's our options? Go into a modified elimination. You've got to think about a modified elimination diet. Rotation and strict elimination, a little bit tougher. But if you've got chronic fatigue, fibromyalgia, and also know that that doesn't mean that just by you going on to one of these dietary scenarios that this is your whole and sole source of your answer. There might be some other things that you need to do. In many cases, we need to heal up the possibility, because if you've got food sensitivities, leaky gut is usually a big issue. Okay, so we need to deal with that. We have the DVD or the teaching live stream. Go view the leaky gut. I really would love for you to do that. The other area then, what do we do supplementally with folks? So we might use a prep called Inflammacor or even Mediclear. And now we just have a new name for this Inflammacor that I'm forgetting, but we have it. It's now available. It's kind of a gut repair plus liver support. It's got nutrients that help the gut repair, lower the inflammatory response in the body. It's got curcumin and green tea catechins, liver support, glutamine. What does this do? This helps with leaky gut. Along with doing an elimination diet, you do some of this support, the Inflammacor. We do some probiotic essentials, probably some high doses, 4 to 5 a day. Maybe even some of the Flora 400s, 2 to 3 a day, 2 scoops a day as a smoothie. Now, why would I be doing this if I've got food allergies? Well, because very high likelihood that the source for many of you that are having food intolerances is right here. That's why I went through that little dissertation on the gut-associated lymphoid tissue, the Galt system. Food particles pass through the intestinal wall. The immune system is programmed to attack. Remember, we're supposed to be tolerant, but if I have compromise in the digestive process, I lose my tolerance because I continue to have invading food particles. The immune system hyper-reacts, hyper-responds. It becomes highly aggravated. I can develop immune deficiencies / autoimmune conditions. So you can't just say, well, I'll get away from the food. If I still have the source of the problem, I've got to get away from the food that's creating a reaction and then heal the area that's weak. You will, over time, you'll lose the recall mechanism. 3 to 6 months many times of a food elimination that you have a high level of reactivity to that's creating those migraines or headaches or those digestive problems or IBS-like symptoms. You get away from them from a number of months. Your body, the lymphocytes lose their recall mechanism. Your body is then resetting. But in the interim, not only we do elimination or do the blood test to define, which we could obviously we can help you with, use a gut repair like Inflammacor, wish I could remember the name of that now, we relabeled that, probiotic essentials, Flora 400s, plenty of food sources of fiber, food fibers, a lot of vegetables. We want to absorb toxic remnants from the gut. So this is all about gut repair. And then obviously plenty of buffered C ascorbates, which helps you repair. So there's I can get into more detail here, but there's a protocol that you would do. So it's not just about elimination of the food. So let's just say you come back, you have wheat and dairy. Okay, well, we want to eliminate these two, and then we want to try to get more to the root, possibly where the problem was. The last area that I'm going to cover, and we're going to close, is that with wheat and dairy, just as a quick aside, wheat and dairy, so let's just do this. Wheat, we'll talk about gluten, and we'll talk about dairy. So you can have a true, IgE reaction, which means it's immediate, and I could take an antihistamine and it resolves it. It's not that big of a deal. I could have a delayed, which is by the immune system, right? Which is really bad because now that can create distant site problems. I can have just a sensitivity to these foods. So the problem here is sometimes when you do this testing, sensitivities don't show up. They're not true allergic reactions. So you can have a sensitivity. So why sometimes an elimination diet along with blood testing is a wise thing to do. And then lastly, this gets very complicated. You could just have an intolerance. So what happens is many folks maybe don't show up on their blood testing, IgE or delayed, which we like to do. They could be sensitive or intolerant. In other words, they could still be having reactions even though they don't show up on this traditional testing to be allergic to it. You can still have a sensitivity or an intolerance. So why I'm a fan often of getting folks just on a modified elimination, clean it up. Let's get rid of colors, dyes, chemicals, preservatives, artificial sweeteners. Let's get you to a whole foods diet. Let's get you to a lower allergen diet. No corn, no soy, no wheat, no dairy, clean. Do smoothies, repair the gut, high doses of probiotics, essentials, Flora 400s, a basic protocol. You will be amazed that when we begin to support and encourage repair, lower the load on the liver. I didn't even get to that. If you go back and watch the Leaky Gut live stream, you will see how this ties together incredibly and how this all pulls. Food sensitivities, food allergies, they could be destroying your health. There's no doubt about it. We want you to be able to learn from this today. If nothing else, is to have this as an overview, to get a picture of what could possibly be going on. Know that what happens in my gut, know that what happens by what I ingest. Think about what is the one thing that we do every single day that we kind of have control over that can ultimately affect our bodies. We're consuming foods and foodstuffs. And for many of you, you're having physical reactions because of something that you're consuming, and it's on a daily basis because many of us are creatures of habit. We eat a lot of the same foods all the time, and unless you define where the problems are, there's just a repeated, ongoing, especially if it's something that you developed later in life. I don't care if it's a digestive problem. I don't care if it's heartburn and GERD. Sometimes this is involved, joint issues, a whole smattering of difficulties that are not disease state, that your physician say, I don't know what's wrong with you. I'm going to put you on steroids. You keep getting these hives. I'll put you on, Atarax. I'm going to put you on Zantac. I'm going to put you on some low-dose prednisone, and I'll see you in 6 weeks. And they're not doing anything wrong. They're just trying to manage your symptoms. And the reality of it is we need to identify what the triggers are, get you on an elimination diet, and then repair. Repair the gut, support the liver. Why? So that we allow the body to reset. That's the key. Let the body reset itself because that's what it's made to be able to do. And then let the body restore. It's God-given. Let the body restore. If I can lower the load, the immunologic load on you, encourage the repair, stop aggravating your immune system, the immune system has a chance to reset itself. It'll repair and on with restoration. The one last thing, I know I said last thing, but here's, as I said that, another thing comes up. There's two quick things about the immune system and why I am so focused on your immune systems, my immune system, because the immune system has a dual nature. Number one, it's to protect, defend you. That's what it's designed to do. With neutrophils, lymphocytes, this whole white blood cell armamentarium. It is designed to protect and defend, kill bacteria, fungus, viruses, destroy cancer cells. It is meant to protect you. This is very key. But when this process, when the immune system is on overload, which for many of us it is, because of food allergies, food sensitivities, a horrible diet, leaky gut, When it's on overload, remember the body will always function from an arena of a hierarchy of need. What's the most pressing scenario? Well, see, it'll always shunt itself to try to protect you. But what goes on? The immune system, two principal roles. Immune system's involved in repairing you and restoring you. So if I'm on overload, I'm overtaxed because of food sensitivities, I'm blowing out my immune system. My immune system is being taxed. It can't do both of these jobs. Its first order of business is to protect and defend you, and therefore then repair gets put onto the back burner. Then what happens? I do not repair, and then this is when I start to have things like joint breakdown, fibromyalgia, and there's a lot of issues with fibro. This is just part of it. Chronic fatigue, more skeletal muscle issues, loss of a sense of well-being. I just don't feel good. I don't feel repaired. The body starts breaking down because repair has been negated. So it's not just about identifying the reaction. That's part of it. But I want to have a viable immune system so that it protects me, defends me, and at the same time repairs me. That's it for today. I hope that helps you. God bless you. Thanks for being with us today. We're all about trying to teach you, trying to offload as much information. Take this hopefully today. I hope it blessed you. Maybe you have a family member or a friend that can be benefited as well by this. I sure hope that you can. Make sure that you tell others about us and go to the website, askjoed.com. View the past live streams. God bless you. Praise God. Thanks for being with us. And remember to be thankful in whatever circumstances that you're in. Easier said than done. I know. I hear you. But as you are and as you're in this situation, and as we learn from Joshua, as we learn from Joseph, as we learn from Moses and Psalm 100, that it's an imperative that we're to be thankful and that we're to praise Him. And also in the book of Thessalonians, that we're to give thanks in all situations. As you do that, I believe He'll honor you. I believe He won't, not that He will elevate you, but He'll allow you to rise above your circumstances. God bless you. Thanks for being with us today. I'll see you on the next live stream.